Good morning, everyone. My name is Mary Hutton. I'm the Regional Director for Community Health Investment in the Washington, Montana region. And on behalf of my Providence partners and the community health investment staff at our local hospitals in Washington, such as Deanne Okazaki in Everett, Angie Woolley in St. Peter's, Centralia and Olympia, Becky Betts in Walla Walla, Karen Hayes in Cadlick in the Tri-Cities, and Sarah Clement Sampson in Spokane. We welcome you and are excited to have you join us today to learn more about the Community Partnership Fund, another way that Providence is supporting and partnering to improve the health of our communities. Now I'd like to introduce you to Sherry Williams, who is the Regional Director at our Swedish Ministries in Seattle.
Hi, good morning, everyone. Thank you, Mary. Again, I'm Sherry Williams. I'm the Regional Director for Community Health Investment for the Swedish region in Washington. So the Swedish region makes up 4 hospitals in King County: Swedish First Hill, Cherry Hill, Ballard, and Issaquah, and 1 hospital in Snohomish County, Swedish Edmonds. We have two ambulatory clinics and 128 primary care clinics. In 2019, Swedish committed $228 million in community benefit to include proactive investments in our community partners. Now Swedish invests in the COVID Resiliency Fund, PPE donations, supporting patients' grocery deliveries, phone calls, and the mobile response clinic. Community and consumer voice is important to us, and we're glad to I'm glad to see so many of our community partners in this virtual room, and glad that you're at the table. If this is an opportunity to learn about the Providence St. Joseph's Health Partnership Fund and develop relationships. So thank you so much for being here today, and I'd like to introduce Gabby.
I think I was talking to myself. So good morning, everyone. My name is Gabriela Robles, and I am the president of St. Joseph Community Partnership Fund. And today we're going to engage in conversation, learn a little bit about the fund, but also we want to learn about what you're doing in the community in the beautiful state of Washington. So just to give you a sense of what the agenda looks like for today, we're going to introduce the fund. We're going to share a little bit about what has been the work of the fund over the last 34 years and what exciting plans we have for the expansion now that we've joined with Providence, now being Providence St. Joseph Health. And most importantly, how we can begin to think about how we want to partner together and address the many issues that impact the lives of the communities that we all serve. As part of our tradition, we always open up our meetings with a reflection. But given that today is such a special day, as all of you know, this morning was a funeral service for Congressman Lewis. One of our colleagues, Carrie Schonwald, shared a beautiful piece that I'd like to read, just to ground us in the spirit of his commitment to justice and community. And so I'll read a couple of words, and then we will share a video that really continues our reflection for today. And I need my glasses. Okay. Here it goes. When historians pick up their pens to write the story of the 21st century, let them say that it was your generation who laid down the heavy burdens of hate at last, and that peace finally triumphed over violence, aggression, and war. So I say to you, walk with the wind, brothers and sisters, and let the spirit of peace and the power of everlasting love be your guide. So he will be greatly missed and definitely part of our generation. I just wanted to share his words with all of you. And now we will also share with you a video that provides you a little bit of context about the fund and Sister Suzanne Sasses, a sister of St. Joseph, who actually started the fund in 1986. Thank you.
At the heart of Catholic healthcare is the healing ministry of Jesus, taking care of the neighbor without distinction, taking care of the poor. St. Joseph Health has been doing care for the poor and community benefits since its inception and before its inception. But we didn't do it because of government regulations. We're doing it because it's the heart, it's the purpose for which we're in healthcare. St. Joseph Foundation, as it was originally called when it was founded in 1986, was founded at the request of the sisters who had said to our first CEO, how are we going to continue taking care of the poor? We're in this ministry. It is a ministry as well as a business. And the purpose of the ministry is to continue the healing ministry of Jesus. And if you go to the scriptures, you see that Jesus took care of everyone. He took care of them body, mind, and spirit. And that has caused us to do the best we can and to evolve as we saw the needs evolving. When we formed our health system, our fear was that our new leaders, who we irreverently then called the suits, because they were mostly men, might not understand how important all that was for us. So we said to our first CEO, how will you assure us that we can continue to take care of the economically poor? The Community Partnership Fund has been a way of expressing, of continuing our legacy of caring. I see the Partnership Fund as being the vehicle that's going to take our legacy of caring for the dear neighbor into the future. I've especially been proud of the systemic change that we've been able to bring about by developing communities, by empowering community leaders. That has brought whole neighborhoods and whole areas to a different level of well-being so that we can keep people well and keep them out of the hospitals. Everything in healthcare is changing. And if we are to continue what we call Catholic healthcare, there has got to go through all that change, the constant of the mission. I hope we all at St. Joseph Health and now Providence St. Joseph carry on this legacy of caring, which is also the legacy of the Sisters of Providence, by continuing to find structures, policies, and programs that will give stability to this aspect of our mission that can move into the future. The hope I hold and the vision I hold is that in the midst of the constant changing and evolution of healthcare, we will remain faithful to caring for the dear neighbor who is close or who is stranger, body, mind, and spirit, continuing to extend the healing ministry of Jesus.
So this is where, we wanted to share the legacy and what has been the vision for the St. Joseph Community Partnership Fund. And I think what's fundamental is that we, along with communities, continue to evolve. And that evolvement has a lot to do in how we work with the community, how we work with our CHI leads, Sherry, Mary, and others across the system. And so that is why we're so excited. We were founded in 1986 by the Sisters of St. Joseph. But now joining Providence St. Joseph Health, we have the opportunity to honor the legacies of both the Sisters of St. Joseph of Orange and the Sisters of Providence. Next, please. And this is the mission statement for the fund. And I think the part that's I always look to is, working, utilizing the strengths and the diversity of our neighbors to build vibrant neighbor communities, and really looking to engaging in the community, listening to our community, and being as supportive, but also allowing the community to tell us how best to serve. Next, please. And this is an introduction to the current team. Jason, like myself, Gabriela. Jason Laxaman is our Senior Program Officer. Alisa Barrios is our Grants Manager. We're a small team. And we also have Carrie Shawnwall and Teresa Beard who are supporting us at this time. And we've been working for the fund for at least, I think, Jason, 6 years, myself, over 10 years. And so we're really looking forward to working with all of you as we move forward. Next, please. And this gives you a snapshot, the next slide, about where does the fund sit within the organization. So the fund, as we call it, sits under the Community Partnerships Division. And as you can see, there's representation and leadership around government affairs and social responsibilities around community health investment, education, philanthropy. So we at the fund and within the division have an opportunity to really tap into all of these skills and assets to really think about how best to serve the community. So it's a very exciting place to be. A little bit about our footprint. So originally our footprint was California, North and South, and parts of Texas. And now in the next slide, you see as part of the expansion, our footprint goes to 7 states. Everything from Alaska to Washington, Oregon, Montana, and continue in New Mexico, Texas, and California. And the next slide, really to highlight the hospital ministries, the ministries within Washington State that we're partnering with that have been very committed to the economically poor and vulnerable. So just to give you a sense of all the support that communities have throughout the state of Washington. Okay, and now Jason will provide you about what we do at the fund. Thank you, Jason.
Hi, thank you, Gabby. Good morning, everyone. Thank you for making a little time this morning and spending it with us, and really happy to, what we are really looking at is building a relationship with all of you and building a partnership as we enter into this new era for our Community Partnership Fund and expand into new regions. New regions for us, but work that is very similar and strategy that is hopefully shared with you. So what do we do? We're a grant maker. We are a foundation that makes grants. We are not a foundation that raises money or does fundraising. We're a strategic grant maker, and you can see here there's bullet points here about what and how we do. We are a foundation, an independent foundation, but we're also within the Providence St. Joseph Health System. We align very closely with the goals and strategies of Providence St. Joseph Health, working within the departments, as Gabby shared, the multiple teams under our community partnerships, working closely to leverage impact, to enhance our impact. We look at grants and we look at investments towards prioritizing bigger, more impactful opportunities, looking at innovation, looking on how we can share learnings. And we'll get into that a little bit more in the presentation. But we know we can't do it alone. And that's where it's meetings and discussions like this to start off and kick off partnerships, partnering not only with regions, but with individual organizations and collaboratives that are doing good work. It is grants and it's funding, but it's more than that too. So I want to reference back a slide that was shared earlier about our mission and really focusing all we do on the quality of life of the most vulnerable and marginalized in our community. And it's in our name, community, partnership, and fund. But in this case, fund also means it's more than just grant funds. It's relationships. So getting back to that relationship part, we have a little bit of a poll. And I want to say that, again, thank you for making time to join us in this virtual open house. Our original plan was to be there with you in person, to meet face to face, to have time for conversations before and after this this open house, and share some cookies and coffee and strawberries, I guess. But obviously, our current time, our current situation, we're not able to do that. But we will pledge to do that when it's safe to do that, when we're able to. So through the wonders of the 21st century, through Zoom and digital meetings, we're trying to make this interactive. So we have a few poll questions, and then later on we'll have a little bit of a breakout group where we'll actually be able to have some smaller group discussions. Each one of the Community Partnership Fund representatives will be in the room and have that opportunity as best we can virtually to learn a little bit more about your work. So I also want to introduce Paul Bonfante, who is one of our consultant partners who's helping assist with this presentation, and we'll walk through a little bit about our poll. Paul.
Hello, everybody. Hello, everybody, and thank you for being here. So you should now have a window popping up asking you 4 questions. The first one being, how familiar are you with the St. Joseph's Community Partnership Fund? So you can just select those options and scroll down to get the other questions. So good. I see that people are voting. We're going to give this a few minutes for everybody to vote, and then we will once the poll closes, we'll share the results.
And I will say that you know, while you're filling out the poll, we may be a new foundation for most of the folks on the call. So if there are questions that come up or certain clarifications, you know, part of the downside of this being virtual and having just a great number of folks that are on this right now, I mean, it's a bit tough to ask a question. We want to encourage people to use the chat function. If you do have a question or a comment, we'll have a little bit of time towards the end of the presentation to answer some of those questions. We will also have those breakout sessions, like I mentioned, to have a chance to ask that. I know that there is a concurrent initiative that we are an initiative offering. It's a Community Recovery and Resilience Initiative where we have an LOI that's actually due tomorrow, and some of you may be applying for that, and you might have some questions about that. We'll have some time at the end of the presentation to get into some of those questions if there's some specific needs there. So again, the wonders of digital meetings, but also the limitations. This is basically a first step. And like I said, this is a relationship building opportunity. We want this not to be the only touch point that we have with you. We're open and available to have follow-up meetings, follow-up calls, scheduling one-on-ones with you and your teams. And you know, we're just happy to join you this morning.
It looks like most people have had a chance to vote, so we'll keep it open for 10 seconds. One or two people have said they had difficulty replying sometimes with phones. There's a little bit of a challenge, but as Jason mentioned, we will be in the breakout rooms, and there'll be opportunities to learn more about you. All right, so we're going to shut down the polling now and sharing the results.
So this is great. This is, you know, this really helps us in understanding where people are coming from. You know, obviously we are a new foundation for the Pacific Northwest. As the video stated, we've been primarily active in the states of California and Texas over the last 30 plus years, but in the Pacific Northwest, we are new. So we're happy again that you're taking a chance on us and taking a chance on learning with us. And now the information you provided and really sharing the work where you have, it's here, question 2, the vast spectrum of need and interest and focus areas that you are engaged in. And then looking at populations, certainly across the spectrum, both age and ethnicity and status, and then looking at communities. And we have quite a spread of folks from different counties in the state of Washington here on the call. And this all helps us. This helps us understand where we can partner, what kind of work you're doing, and how that aligns with the strategic focus areas that we have. Again, we don't view ourselves as a traditional grant maker. We really feel that in order for us to address the needs of the community, it takes a partnership. It takes authentic conversations and shared struggle, and developing and co-designing strategy. So thank you for sharing that. I think on the next slide, we can get into a bit of our strategic framework that we hope to engage to have impact in our communities. So I think there's some buzzwords, especially in the last couple months that you may have seen much more in the mainstream. This is a foundational framework for us that we've been engaged in over the last several years. We're really looking at a focus on the upstream, and it says here social determinants of health, but really much more than that. What are the root causes? How can we have impacts at that level, which we know will have downstream impacts on things like services and conditions in community? A focus on equity, and not just health equity and not just as a buzzword, but really how do we operationalize a commitment to equity? And we'll get more into that in the presentation. Partnership being intentionally collaborative, responsive to the community needs and also opportunities that are there, and being innovative. We're not afraid to take risks. That's exactly where we need to be. I think if it were easy, if things had been figured out already, we'd be doing them. But I think we are here to partner. We're here to learn. We're here to elevate promising strategies and invest in them. So these are our pillars. They guide our strategy. They inform our strategy. And these five, upstream, collaborative, community, innovation, that all leads to equity. Our strategies focus on addressing, improving, and redesigning community-level systems towards equity and justice. So it's not just services, though we know that's important. And it's not just a clinical or a medical approach or medical model, though we know that's a part of it too. It is really these elements that are with a focus on equity that leads our vision. So we go to the next slide, a little bit more. And I know that social determinants of health over the last few years has been much more, there's much more awareness in the community. I don't want to belabor the point, but a definition that we use is that the determinants of health are conditions in which people are born, grow, live, work, and age. And I also like to add where they play and they pray. These circumstances are shaped by the distribution of money, power, and resources at the global, national, and local levels. Again, for many of us, this is not new, but it's really about how are we addressing root causes. I think when you look at our previous initiatives in grant making, traditionally, we have worked with and supported organizations that have provided needed resources, needed services, emergency services in some places in the community, and that's of critical importance. But there's also elements of our initiatives that are more than that. We know that we need to do more. It's what we call a yes and approach. Yes to meeting the immediate needs and investing in strategies that impact root causes that address community systems, system inequities, and injustices. This is something that's across all of our strategies, and it's part of how we define how we operate in the upstream. And the next slide is about a focus on equity. And, you know, again, we know that things like where you live, your zip code, confluence of factors is a better predictor of health than your genetic code. We believe that health inequities are real. They're not something made up. It's based on policies of the past, cultural histories, factors that date back decades, hundreds of years, and things that we're dealing with now. We believe that all of our grant making must address equity, not just health equity, but equity at its core. A little bit about equity. This is also about racial equity and justice, and supporting strategies that operationalize investments towards equity. So we go to the next slide. I want to turn it back to Gabby.
Thanks again. Just wanted to highlight in regards to collaboration, and we use the word intentional because it's really part of our DNA, our values, to really leverage those relationships within the communities that we serve, and also to help position the communities that we serve with other funders and other networks so that we can truly collaborate and hopefully support all of the work that all of you do. So here you see a sample of some of our current partners, in addition, of course, to all of the hospital ministries and ministries of Providence St. Joseph Health, including Swedish and Hoag Hospital here in Newport Beach. Next, please. Okay. And another philosophy that we have is that we need to meet the community where we are, where they are, not where we are, where they are. And so it's very easy for us to get academic. Coming from healthcare, we've got a lot of great data and a lot of amazing studies, but we need to meet the community where they are, because they are the experts and they are the teachers for us to understand not only what is the issue. So the data might help us in identifying those zip codes or those conditions, but it's really meeting with the community and understanding, is this truly an issue in your community? And if it is, what are some of the solutions that you and your families and your local networks have in mind? And so that is how we've evolved, how we engage, how we invest, and really have been seeking input from the community in developing some of the initiatives that you'll hear about in the next couple of slides. And this takes time. All of you know that. Working in the nonprofit sector, we use the word collaboration very freely, but you all know that if we are truly meeting people where they are and walking with the community, it takes time. But then we also know it's worth it. It's worth it because that is where we start seeing impact and ownership of the work. And so that's the value and really the philosophy that we have been hardwired into the work of the fund. Next, please. And innovative. There's been many conversations we've had with our board about how we need to think outside the box. Yes, we are a grant-making foundation within the third largest health system in the country. But we also have to think about in the community, how do we be innovative in developing initiatives that may not give us data for maybe 3 to 5 years, if that. Again, we're so focused on our clinical data, which is very valuable in serving our patients and our communities, but in the work that we all do, that you do, it's really seeing the opportunity to be a little bit more innovative while we're developing data. A lot of it may be qualitative. And how do we invest in that data as well? And that's another commitment that we have, is how do we develop with other partners some of this data from the community that really tells a story, that demonstrates that impact. And so throughout the years, we've taken on some risks. We've done some things a little bit non-traditional. And we've always brought that back to our board and to our leadership. And we've learned a lot. And really that is one approach that we find very valuable in this work, and that has had a lot of impact. So just know that We do value innovation, and we balance that with the work of the community and the knowledge. And we also look at our data. Our community health investment leads have amazing data, both qualitative and quantitative, as part of their community benefit process, their 3-year plans. And so we definitely also look at that work to really seek to understand what should be the best strategy and approach in the work that we do. Okay, next slide, please. I think the next is Jason. We'll share with you what are the focus areas for the St. Joseph Community Partnership Fund. Just to provide you some context, these focus areas were identified as a result of us meeting with our grantees, meeting with funders, meeting with our CHI leads, looking at data, and with our executive leadership. And these are the focus areas of the fund that we're bringing forward to all of you. Okay, Jason.
So capacity building, housing, education, disaster response, and also disaster resiliency. You know, I will go, and this is really where we're looking at in 2020 and 21 and beyond of where we're going to go. Looking at these, you may be asking, but aren't you a health foundation? This doesn't sound like health. This doesn't sound like, well, it just doesn't sound like traditional health. And it is, but it isn't. In our strategy, we're recognizing the intersectionality between these issues. And as we talked about going upstream, you go upstream far enough, all of these issues intersect. If you have an upstream strategy, it's going to have downstream effects on housing, on education, on disaster, on health. But we also recognize the interplay between these issues, that housing, things like housing insecurity, those who are housing insecure will often have more poor health outcomes. We know that there's a link between education, and not just educational attainment and health, but also mental and behavioral health, that there are some detrimental practices, lack of access to education that has impacts on health, things like addressing restorative justice in schools, addressing the school to prison pipeline. That is a public health issue as well. And disasters. It came out much more in the COVID-19 pandemic that we're currently in. But this has always been the case, that disasters lay inequities bare, that those who are affected the most in a disaster are often those that were already struggling, that were already marginalized before. And so taking the longer view in a disaster response is much more about how do we build communities, how do we prepare, how do we build resilience, and looking at that across. Here, capacity building is its own share of the pie, I guess you could say. But capacity building is across all of these focus areas for us. We go to the next slide. I know this is kind of a little maybe academic for us because these are grant initiatives that were active outside of the Northwest region right now. But this is where we're coming from. Over the last 30 years, we've been engaged in these kinds of grant initiatives. And it is that yes and approach. You could see that we have an emergency food and shelter initiative, which provided direct service support or support for direct services to nonprofits who are engaged in serving the most vulnerable groups that were like food pantries, food hubs, food banks, shelters, domestic violence shelters, homeless shelters, care coordination amongst groups, amongst clinics. That's part of our history. But also looking, how do we move a bit upstream in our strategies? We have a community building initiative, which is really focused on neighborhoods and resident leadership to tackle issues in their community. We have what's called the Intersections Initiative, which meets, like Gabby said, meets the community where they are in terms of capacity and need. And this one is a $4 million 3-year place-based initiative where we're providing supports to community, multi-sectoral community collaboratives who are trying to address community trauma as articulated through housing, as articulated through immigration, as articulated through education policies that will have a policy impact in these communities. Disaster relief, a sustainability initiative, which is really about nonprofit strengthening. And again, as Gabby referenced, looking at innovations. What are some new promising practices that are emerging from the community that we can support, that we can help elevate learnings from, that will be able to be shared across the sector. If you take a step back and perhaps we just simplify, all of our initiatives are capacity building initiatives, like I said. They're just at different levels. Whether it's through our community building initiative, which is about individuals and neighborhoods, organizing and movement building, our sustainability initiative, which is around nonprofits, individual nonprofits, but also the nonprofit sector strengthening, and the intersections, which is about coalitions, county or community-wide sectors. We really believe that capacity is an important investment and a prerequisite of what we need to do. It's a prerequisite to get to this upstream goal of equity. So again, some of our investments certainly are meeting individual needs. And I know we have service providers on the call, and that's part of our strategy. But along the way, there's also a goal for us to achieve systems improvements, organizational practice change, policy impacts, and overall building community power and voice. These are capacities and strategies that are built and sustained. And as we look towards a partnership, as we look towards an investment or a grant, we're always thinking about what are we building? It's not just here's the money and go and do, but what can we do together? How can we partner? And what are we leaving behind after that grant investment is completed that will continue to be built upon? It's a little bit of our philosophy of our work. So our first foray as our fund, as our foundation, was in the COVID-19 response. And across the Providence St. Joseph Health System, the system is divided into 7 regions. And in the early days of the pandemic, back in March and April, there was a rapid deployment of funds into our communities. We worked very closely with some of our colleagues at the regional level at Providence to identify and get some funding out to organizations that were focused on the most poor and vulnerable, and to really help prevent the spread of COVID-19. And so we had 2 or 3 organizations per region identified as just an initial response. In some areas, we were working closely with other funders in the area, leveraging our funds, being a bit strategic, but this was about just getting some initial resources out to help at the front line. Since then, we've taken the time to assess and talk not only within our system leadership, but again, with community members, with community organizations, and also other grant makers. And use that information and use that due diligence to inform what we're calling a phase 2 of the COVID-19 response that has longer range implications as well. And this is where I think many of you have heard or are applying for is our Community Recovery and Resilience Initiative. This is our new initiative for 2020. It won't be the only one for us as we move forward, but it's again, I think a first foray into grant making into this region. It's really designed and focused on collaboratives and the collective capacity to work together. it's really an acknowledgement that we're, as much as you think back to February seems so long ago, we're not going to go back to February. I think right now we are in the middle of COVID-19. There's not a post-COVID-19 right now. We're going to continue to deal with the human and economic and community impacts that COVID-19 is rearing, as creating, and it's an acknowledgement of that. And we know that it's not just individual supports that are needed. We're going to need to do that, yes, but we're also going to have to focus on the capacity of collaboratives who are working together, that can leverage the work, that can leverage the resources, and support these community structures necessary for the long haul. Again, it's a recognition that those who are affected by this were likely affected, that were already marginalized before the pandemic. And so it is in line with what we are seeing in the field of philanthropy and grant making, that there's this recognition to invest, to build, at the same time as investing to provide services. So again, it's this yes and approach where capacity and root cause is focused upon. We'll get a little bit more into the LOI process. I know that a few of you have applied. It's something that we want to also share, that this is not the only initiative that we're going to have. We're going to have many more initiatives that are coming down in 2021 and beyond. But this is at its base an opportunity to support organizations that are doing work now and can be positioned for greater work in the future. So beyond that, beyond grant making and investments, in the next slide, the Community Partnership Fund engages in supports research and field building. And this is about identifying and sharing best practices to inform the field. And things like supporting convenings, community convenings, bringing nonprofits and grant makers and philanthropy together. It's also publications, sharing data, elevating reports that provide new frameworks for community stakeholders, for grant makers, for investors, for nonprofits, for government. This is part of the upstream work too. Here there's a couple examples of what we've done in some of our regions, things about how do we operationalize equity, how do we look at data that informs equity strategies, how do we look at an informed response to disaster, how do we look at, again, looking at services, more equitable care coordination to systems impacts. This is part of our role, and this is part of the opportunity that we want to partner with you, that if there's ideas, if there's a need, if there's an opportunity to elevate a learning and help build an evidence base. We hear a lot about, well, we need to just invest in evidence-based practices. Well, this is about helping build that evidence base, helping take an informed strategy and make it evidence, and adding that evidence to the field that can be referenced and built upon and invested in. So I think we'll pause now and see if there are any questions that have come up. I think there's some questions that have come up to us directly. I got one, Jason. This sounds interesting. Can we set up one-on-ones to talk and share our work? Yes, that's what this is about. We have many more. I think through the wonders again of technologies, we could set up some more Zooms with your organization and talk. We're happy to do that. Again, we have a breakout session coming up. We could talk a little bit more about your work there. What do you mean by non-traditional grant making? I'll give you an example. in one of our previous initiatives, our community building initiative, we had a very traditional grant making process. And for those development directors and grant writers on the call, it's going to be a bit more familiar to you. There's an RFP that's released. There's a 5 to 15 page application you submit your financials, and then you submit it back, and you hope for the best. And we realized that placed a lot of burden on community organizations. Doing this process, writing up an application and submitting, there's no funding behind that. So you're taking an investment of time without guarantee of return. You hope for the return. And so we changed that process in a way that we put a lot more of that responsibility on our staff, that we wanted to go out and build relationships and learn about what was going on in community and bring that back before we entered into a grant application process. So that means a lot more discussion at the front end. That means things like putting out an LOI, which is much more simple than a full application. And then from there, leading to conversations and lower intensity site visits. And then when we get to an actual application, asking for just very direct, very summarized information. So gone are the days for us of these 30-page applications, and really more into knowing what people are doing before the application is even submitted. Go back to some of the questions that are in the chat. There's a question here about, do religious organizations have any higher weighting than secular ones? I think we work with everyone. I think we do have some ethical directives, but if you're focused on the most poor and vulnerable in our communities, if you're providing services or have strategies that aim to address systems, we want to work with you. So we certainly, in our past grantee portfolio, we've had Catholic Charities, we've had St. Vincent de Paul, but we've also had various community clinics that are not affiliated with Providence or St. Joseph Health. We have ethnic community serving nonprofit organizations that we have supported. We have, we view partnership and diverse partnerships and value those partnerships. Let's see some of the other questions, and we'll have more time later. I know that we're running into some timeline issues here, but our grant making area is the footprint of Providence St. Joseph Health. So, and those are the service areas of Providence St. Joseph Health. So it's not necessarily just the city or the town where a hospital or a medical office is located, but there's a geographic footprint that surrounds that. Sometimes it's multiple cities, sometimes it's multiple counties. We could provide more information on those exact footprints, but if you are a regional organization that touches one of that, we'd be happy to work with you. If you are statewide or countywide, certainly that is something that we can also work with you on. So I think there's other questions, we'll get to that, but I do want to turn it back to Paul, because I think we can get to some of these questions also during our breakout sessions.
Thank you, Jason. So what we're going to do for the next 20 minutes is breakout groups. So in about a minute, you will be put into one of 4 breakout groups. Each group will have a facilitator and note taker, and that facilitator will walk you through a few questions. So first of all, they'll ask you to introduce yourself in the chat. Unfortunately, time does not permit us to have everybody introduced, but we introduce in the chat. And then talking a little bit about collaboratives you're involved in or know about in your area. And then the biggest part of the breakout group will be, just as it says on the screen, dreaming big. If you had a magic wand, what change would you make in the community, in your community, in our communities, to have the most impact? And this is really designed to be a brainstorming session both for you all to think about it and talk about it for yourselves, but also for the fun to understand the ideas, the obstacles, the challenges, the opportunities in your communities. It's not intended to be a problem-solving session because, again, they're going to be big dreams. We just kind of want to get them out there so everybody can hear. And then at the end of the breakout group, you'll get a 60-second warning. You'll be invited to come back into the main session, and then we will all go back here, and the facilitators will report out. So again, what's going to happen in just a few seconds is you're going to get moved to a breakout room. You don't have to do a new Zoom link or anything. It'll just move you automatically. And then when we're finished, you'll get moved back in here. So thank you. And we are now going to open the breakout groups.
Hello, everyone. Thank you to breakout room number 3. I'm Haley, and thank you so much for sharing all that you did. As I said, I won't be able to capture all of the names of your organizations and collaboratives that you shared, but we have it recorded and we have it also saved in our chat, and there's a lot of collaboration going on. The BHAGs that were shared, there was a lot around education of all groups in society, employers, public education, many at the city level, public sector, all about normalizing mental health and focusing on mental health and making mental health as much of a priority as other physical health. That's a big, hairy, audacious goal that was shared, as well as just achieving social justice and outcomes and racial equity, also through education, trainers that understand and can identify systemic racism and educate folks out of, reiterating and reinforcing systemic racism. There is also just a goal of providing comprehensive services for mental health, aside from education, just really providing comprehensive services because of how the lack of services ties into homelessness and lack of wellness in general. So addiction treatment centers, behavioral health in general available to those in need. And of course, they're very specific folks that shared, we have a need in this community, but that is a BHAG for the region. Ending poverty was shared, absolutely. And the only way to end poverty is to break down silos, get rid of them, and work together. Also, just homelessness in general, ending it by diving deep into the root causes of it, which were behavioral health, access to housing, addiction, all of those things were mentioned as root causes of homelessness. And we also discussed providing services for and comprehensive systems for the early learners, for our early childhood community and the families that these children exist in and thrive in. So I think that the main topics, really, the BHAGs, were around mental health, systemic racism, social justice, poverty, homelessness, addiction, and early childhood and family, just to kind of recap. So I'm sure that I left something out because you shared a lot, but thank you for sharing. Really, really exciting goals for your region.
Thank you. Marilyn, please.
So in breakout group number 4, there were just a handful of ideas. So the main one was dealing with these big disparities amongst communities of color, especially in the time of COVID. So question was, how can we address structural racism across the board? So housing, healthcare, education, etc. And how can we as a group really work to uplift these communities? That was one of the main BHAGs that was brought up in group number 4. Another one was, the issue with discharging homeless populations from hospitals into the community, and then there not being enough housing options for them, and also not having good or accessible medical support for them. And then a third one was just talking about the most vulnerable populations and the ability or the accessibility of technology right now. So whereas maybe it was available or accessible for them before, right now it might not be for a number of reasons. And so just, you know, kind of trying to figure out how we can address that. So those were kind of the main three that we talked about in group number 4. And thank you everyone in that breakout group for your participation. So thank you.
Thank you. Carrie, please.
Yeah, I believe I was group breakout number 2. And thank you everyone for sharing your ideas and your work. Some of the BHAGs that came up in our group, some of the themes that have already been mentioned, but more specifically, ending child abuse, especially as it has increased enormously during COVID. Working more collaboratively across systems, particularly when it comes to hospital releases and ensuring that patients aren't just lost after they get out of the hospital. Also figuring out how to kind of make an end run around ineffective government to ensure that the needs of our communities are being met and not blocked, even when they make clear good sense to everybody. And and really building community and community connections and ensuring that vulnerable populations like seniors and others are cared for in the way that communities that are well connected can care for the vulnerable. I think those were the main points. I think that covers the gist.
Thank you, Carrie. I'll go last. And so by going last, a lot of what my group has discussed, group number 1 came up already, but we spent a lot of time talking about the need to open up conversations among providers to provide more easier ways for data sharing, especially when HIPAA, which is there for a good reason, is a factor, and really enable organizations to talk better together. We also did talk about housing instability. We talked about addressing racial disparities, about the healthcare system looking at the whole person. But the big thing we talked about was that idea of being able to share and talk more easily. So thank you everybody in my group, and thank you to all our facilitators for the report outs. I think I'm going to hand it to Gabby for the closing.
Thank you. Thank you again. I was part of, I believe, group 2 with Carrie, and I did express how grateful we are for all of you joining us today, and also for sharing your visions and your passions for the communities that you serve. And just to let you know that that is what gets us going. That is the driving force and why we exist, and recognizing we can't do it alone. So thank you so much for your commitments in serving. And just want to also thank both Mary and Sherry, our regional directors for community health investment for the state of Washington. Looking forward to partnering with them along with their teams, and how we can come together in partnership with you in addressing the needs of the community and the solutions. That's always very important to emphasize. We already have some ideas on what the solutions are. So looking forward to that partnership. And just want to give you a little bit about what's next steps. I'll walk you through the next steps, and then we'll have a couple of minutes in case some of you have some questions, as Jason mentioned, about the letter of introduction that is due tomorrow by noon. So let me share with you what we see as the next step. So in the next 6 months, we will be selecting recipients for support as part of our commitment as phase 2 for COVID-19. We will continue to strive to learn more about your communities in many ways. So either through the website, through technology, and hopefully one day in person. And we will continue to implement our strategies throughout the regions here at Providence St. Joseph Health. And again, thank you, very grateful. And I think we have a couple of minutes, Jason, if there are some questions about the letter of introduction that you'd like to share with us.
Yeah.
We can address
So
those.
also, Yeah, great. Thank you. Go back to the last slide. I know there's some questions about, can we connect? Can we set up a one-on-one? Here's our email. It'll get to us. Trust me, it'll get to us. So please use this if you want to set up time to talk. There were some requests in our breakout session actually to do that. If you want to learn more about us, this is our website. It has much more information about our past initiatives and current initiatives and our next steps, as well as the regions we cover. Again, I think it was at the front end where we've been primarily active in California and Texas, but now we're going into 7 regions and hopefully learn, but also provide resources to those places. There was an earlier question in the chat around capacity building and sustainability. I think we can get more into that, and this is maybe a question that might be good for a one-on-one, but capacity building we see is sustainability, and that in order to get us where we need to go, we need to focus on that, have the idea of what are we building at the front end, and that there's a question about autonomy from whether the health system or the foundation, and really that's the goal. We want to have groups that are self-sustaining, that are able to not be dependent on grant funds, but really to use the time, use the investment from us to engage in structural work. That may result in deeper relationships actually with the health system, but as a partner as opposed to a grantee. I do know that so this is a general portion of the open house, but then we have the community resilience or community recovery and resilience initiative LOI that's due tomorrow. And if there's any questions about that, we could take them now.